Imagine walking into a doctor's office where every piece of medical data you provide is instantly analyzed by an AI system that can spot patterns and anomalies far quicker than any human could. That's not just science fiction, it's happening right now. According to a report from Accenture, the global market for AI in healthcare is projected to grow to $6 billion by 2021, up from just $600 million in 2014. This rapid growth reflects how AI is becoming an integral part of diagnostics, treatment plans, and personalized medicine. Just think about radiology. AI can now analyze medical images with a level of precision that surpasses human capabilities, detecting early signs of diseases like cancer or Alzheimer's before they become clinically evident. It's like having a super smart assistant who never gets tired or misses a detail. This is just the beginning of how AI is revolutionizing healthcare, and in the next segment, we'll dive deeper into some specific applications where AI is making a real difference. AI is already making waves in healthcare through diagnostics, where it can analyze medical images faster and sometimes more accurately than human doctors. For instance, AI algorithms have shown they can detect signs of lung cancer from CT scans with an accuracy rate as high as 94%, compared to about 65% for radiologists. This not only speeds up the diagnosis process, but also improves patient outcomes by catching diseases earlier. In patient monitoring, AI systems can continuously track vital signs and predict potential health issues before they become critical. Imagine a smart hospital bed that monitors your heart rate, blood pressure, and even sleep patterns, alerting healthcare providers to any anomalies in real time. This kind of proactive care is revolutionizing how we manage chronic conditions like diabetes or heart disease. And when it comes to drug development, AI can sift through vast amounts of data to identify potential new drugs or repurpose existing ones for different diseases. For example, benevolent AI used machine learning to predict that an existing arthritis medication could be effective against COVID-19, a discovery that would have taken years without the help of AI. Next up, we'll dive into how these applications are changing the day-to-day operations in hospitals and clinics around the world. Imagine you have an X-ray that needs reading. Traditionally, this task falls on radiologists who spend years training their eyes to spot anomalies in medical images. But now, AI is stepping up to the plate and doing it faster and often more accurately. For instance, a study published in Nature found that AI systems can detect breast cancer from mammograms with an accuracy rate of 94%, which is comparable to human radiologists. What's even more impressive is that AI can process these images in seconds, drastically reducing waiting times for patients. Think about it this way. If you had 1,000,000 pixels on an X-ray image and needed to find one pixel that's off, AI can quickly scan the entire image without getting tired or missing anything critical. This speed and accuracy mean faster diagnoses and quicker treatment plans. And as we move forward, the integration of AI in diagnostics will only get smarter and more efficient. Next, let's dive into how AI is helping to personalize treatment plans based on patient data. AI is transforming drug development by significantly speeding up the process. Traditionally, bringing a new drug to market can take over a decade and cost upwards of $2 billion. But AI can cut this time in half and reduce costs dramatically. For example, in silico medicine used AI to discover a potential treatment for idiopathic pulmonary fibrosis in just 46 days, compared to the usual years it would have taken using traditional methods. AI does this by rapidly analyzing vast amounts of data. Think of it like having a super smart assistant who can read every medical study ever written and instantly spot patterns that could lead to new drug candidates. This means researchers can focus on the most promising leads, skipping over dead ends much faster than before. Next up, we'll dive into how AI is making personalized medicine a reality by tailoring treatments to individual patients. Stay tuned. As we move forward in our exploration of AI in healthcare, it's crucial to address the ethical implications that come into play. Just like any powerful tool, AI has the potential for both immense good and significant harm. For instance, studies have shown that biased algorithms can lead to disparities in patient care, particularly affecting minority groups. This isn't just a theoretical concern. A 2019 study published in Science found that an algorithm widely used in healthcare was less likely to refer Black patients who were as sick as white patients for additional support. These ethical considerations are not just about fairness and equity, but also about trust. If patients feel their data is being misused or misrepresented, it can erode the very foundation of the doctor-patient relationship. So, how do we navigate these challenges? In our next segment, we'll dive into specific strategies that healthcare providers and tech companies are using to ensure AI applications are both effective and ethical. Stay with us as we uncover more about this critical aspect of AI in healthcare. Privacy is a huge concern when it comes to AI in healthcare. Think about it. Your medical records contain deeply personal information that you wouldn't share even with close friends. Now imagine this data being processed by algorithms. There's always the risk of breaches, and the more widespread the use of AI, the higher the stakes. For example, a 2019 study found that over 27 million patient records were compromised in healthcare data breaches alone. Bias is another major issue. If an algorithm is trained on data that doesn't represent all demographics equally, it can lead to unfair outcomes. For instance, if most of the data used to train an AI tool comes from one racial group, the results may not be as accurate or fair for other groups. Transparency is also crucial. When a doctor uses an AI tool to make a diagnosis, patients have the right to know how that decision was made. Without transparency, it's hard to trust these systems fully. Next, let's dive into some real-world examples where these ethical concerns have played out in healthcare settings. Bias in AI algorithms is a critical issue because it can perpetuate existing inequalities and discrimination within healthcare systems. For instance, if an AI model is trained on historical data that reflects past biases against certain groups, like racial minorities or people from low socioeconomic backgrounds, these biases will be baked into the algorithm's decision-making process. A real-world example comes from a study published in Science, which found that an algorithm used to predict patient needs was biased against Black patients because it relied on healthcare costs as a measure of health needs. Since Black patients historically received less medical care and had lower healthcare spending, the algorithm incorrectly flagged them as healthier than they actually were. To address this issue, we need to ensure diverse and representative datasets are used for training AI models. This means including data from various demographic groups to prevent skewed outcomes. Next up, we'll dive into how transparency in AI algorithms can help mitigate these biases. Imagine you have a crystal ball that can predict when and where diseases might strike next. That's essentially what AI is doing in public health today. For instance, during the Ebola outbreak in West Africa, researchers used machine learning algorithms to analyze data from social media, news reports, and other sources to predict the spread of the disease. This helped health officials allocate resources more effectively. AI can process vast amounts of real-time data much faster than humans, spotting patterns that might signal an upcoming epidemic or pandemic. In fact, AI systems were able to detect signs of the COVID-19 outbreak in Wuhan as early as December 2019 by analyzing online reports and social media posts. By predicting disease outbreaks, AI can help us prepare better, saving lives and resources. This is just scratching the surface of how AI transforms public health management. Next up, let's dive into how AI is revolutionizing personalized medicine. Now that we've covered some of the foundational aspects and potential benefits of AI in healthcare, let's dive into some real-world examples to see how these technologies are making an impact today. For instance, IBM Watson has been used to analyze vast amounts of medical data to help doctors identify treatment options for cancer patients. In fact, a study showed that Watson recommended the same treatment as oncologists 90% of the time, highlighting its accuracy and reliability. Moving forward, we'll explore specific case studies where AI has transformed patient care, from improving diagnostic accuracy in radiology to enhancing personalized medicine through genetic analysis. These examples will not only illustrate the practical applications, but also shed light on the challenges and ethical considerations involved. Stay with me as we uncover how these groundbreaking technologies are reshaping healthcare one case at a time. Imagine you have a highly skilled radiologist who has seen thousands of X-rays and MRIs in their career. Now, picture an AI system trained on millions of medical images. Studies show that this AI can detect early signs of cancer with up to 95% accuracy, which is significantly higher than human experts alone. For instance, in a recent study published in Nature, an AI model was able to identify breast cancer from mammograms with fewer false positives and negatives compared to 6 radiologists. This kind of technology means that patients can get earlier diagnoses, leading to better treatment outcomes and potentially saving lives. The key here is the sheer volume of data AI can process and learn from, allowing it to spot subtle patterns that might escape human eyes. As we move forward, integrating AI into healthcare could revolutionize how we detect and treat diseases like cancer. Next, let's dive into how AI is transforming personalized medicine. Imagine you have a tiny doctor always on your wrist, monitoring your every heartbeat and tracking your vital signs around the clock. That's exactly what wearable technology does in healthcare today. Devices like smartwatches can now detect irregular heart rhythms, track blood oxygen levels, and even monitor sleep patterns. For example, a study published in the New England Journal of Medicine found that Apple Watches detected atrial fibrillation in 34% of participants who were notified by their watch, leading to timely medical intervention. This real-time monitoring not only helps catch health issues early, but also allows for continuous care outside hospital settings. Picture this: if your wearable detects a sudden spike in heart rate or a drop in blood oxygen level while you're at home, it can alert both you and your healthcare provider immediately. This kind of immediate feedback loop is revolutionizing how we manage chronic conditions and prevent emergencies. Next, let's dive into how AI analyzes the data from these wearables to provide personalized health insights. AI is transforming the healthcare landscape, but it's not just about replacing jobs, it's more about reshaping them. For instance, radiologists are increasingly working alongside AI tools that can detect anomalies in medical images faster than humans. This doesn't mean radiologists become obsolete. Instead, they spend less time on routine tasks and more on complex cases where human expertise is crucial. A study by Accenture found that AI could save the U.S. healthcare economy up to $150 billion annually by 2026 through improved efficiency. Think of it like a co-pilot in an airplane. AI handles the mundane navigation, allowing the pilot to focus on critical decision-making and unexpected situations. Similarly, nurses are using AI for predictive analytics, helping them anticipate patient needs before they arise. So while some tasks may become automated, healthcare jobs evolve into more specialized roles that require advanced skills and human touch. Next up, we'll dive into how these changes affect the overall quality of care patients receive. As we move forward, it's clear that AI is set to revolutionize healthcare even further. Just imagine, by 2026, the global market for AI in healthcare could reach $6 billion. That's a massive leap from where we are now. Picture doctors using predictive analytics to spot diseases before they become critical. Or think about personalized treatment plans, tailored with machine learning algorithms that analyze your unique genetic makeup and lifestyle. It's not just about efficiency. It's about precision and care on an entirely new level. And let's talk about robotic surgery. Already, robots like the Da Vinci system are performing minimally invasive surgeries with incredible accuracy. So as we look ahead, how will these advancements change our hospitals, our clinics, and ultimately our lives? The possibilities are vast, but so are the challenges. In the next segment, we'll dive into some of those challenges and what they mean for the future of healthcare. The future of medicine is undeniably intertwined with AI, and we're just scratching the surface. Imagine a world where AI can predict diseases before symptoms even appear. For instance, Google's DeepMind has already made strides in early detection of eye diseases using machine learning algorithms that analyze retinal scans more accurately than human doctors in some cases. This kind of technology could save countless lives by catching illnesses early on. AI is also revolutionizing drug development. Traditionally, bringing a new drug to market can take over a decade and cost billions. With AI, we're seeing timelines shrink dramatically as algorithms sift through massive datasets to identify potential treatments much faster than traditional methods. For example, in silico medicine used AI to discover a new drug for treating idiopathic pulmonary fibrosis in just 21 days. As we move forward, expect to see more personalized medicine driven by AI, where treatment plans are tailored specifically to your genetic makeup and medical history. The possibilities are endless, and the next scene will dive deeper into how these advancements can transform patient care on a global scale. Regulatory frameworks are a big hurdle when it comes to adopting AI in healthcare. For instance, the FDA has been cautious about approving AI tools because they need to ensure safety and efficacy. In 2019, only one AI-powered medical device was approved by the FDA, which shows how slow the process can be. On top of that, integrating new AI technologies with existing hospital systems is like trying to fit a square peg into a round hole. Many hospitals still use outdated software that doesn't play nice with modern AI tools. This means healthcare providers often have to spend extra time and money on custom integrations or overhauling their entire tech infrastructure. These challenges can slow down the adoption of AI, but they're crucial for ensuring patient safety and effective care delivery. Next, let's dive into how AI is already transforming specific areas like radiology and diagnostics. Patient trust is the cornerstone for any healthcare advancement, and AI is no exception. According to a recent survey by PwC, about 60% of patients are comfortable with AI-assisted diagnoses, but that still leaves a significant portion who aren't so sure. Imagine you're at the doctor's office, and instead of a stethoscope, they pull out an algorithm to diagnose your condition. Would you feel as confident? This is where transparency comes in. Hospitals and clinics need to clearly communicate how AI systems work and why they're beneficial. For example, AI can help detect diseases like cancer earlier by analyzing medical images more accurately than the human eye. But to truly harness this power, we need to build trust through education and clear communication about what AI can and cannot do. Next, let's dive into some real-world examples of how hospitals are already using AI effectively while keeping patient trust at the forefront. As we wrap up our journey through the impact of AI in healthcare, it's clear that the integration of artificial intelligence has transformed how we diagnose and treat diseases. From improving diagnostic accuracy by up to 90% in certain areas like radiology to streamlining patient care with predictive analytics, AI is making a tangible difference. Just think about IBM Watson's contributions to cancer research or Google DeepMind's work on eye disease detection. These advancements not only save lives, but also reduce healthcare costs and improve the overall quality of care. As we move forward, expect even more innovations like personalized medicine and smarter wearable devices that can monitor health in real time. In our next segment, let's explore some of the ethical considerations surrounding AI in healthcare to get a fuller picture of this transformative technology. AI is truly reshaping modern medicine in ways that were once unimaginable. Just think about it. AI algorithms can analyze medical images like MRIs and CT scans up to 150 times faster than human radiologists, with a 94% accuracy rate. That means quicker diagnosis and treatment for patients, potentially saving lives. In cancer care alone, AI is enabling more precise diagnoses and personalized treatments based on an individual's genetic makeup. This isn't just about speed, it's also about precision and the potential to catch diseases early when they are most treatable. And let's not forget the role of AI in managing chronic conditions like diabetes or heart disease through continuous monitoring and predictive analytics, helping patients stay healthier longer. As we move forward, the integration of AI into healthcare will only deepen, making our medical systems more efficient and patient care more personalized. Next up, we'll dive into some of the ethical considerations that come with such powerful technology in healthcare. As we wrap up our journey into the world of AI in healthcare, it's clear that the future of medicine is deeply intertwined with artificial intelligence. Just think about this. AI systems can analyze vast amounts of medical data faster than any human could, leading to quicker diagnoses and more personalized treatments. For example, IBM Watson has already been used in oncology to help doctors make informed decisions based on a patient's specific cancer type and genetic makeup. However, the road ahead is not without its challenges. We must ensure that AI technologies are developed ethically, with transparency and fairness at their core. This means addressing issues like data privacy and algorithmic bias. The future of healthcare depends on our ability to balance innovation with responsibility as we move forward. It's crucial for everyone, from researchers and clinicians to policymakers and patients, to stay informed and engaged in this evolving landscape. So let's keep exploring how AI can revolutionize healthcare while making sure these advancements benefit us all. This video is for educational and informational purposes only and does not constitute financial advice. We are not licensed financial advisors. Always consult a qualified professional before making any financial decisions. For more resources, visit https://micronishamarket, gumroad.com/.